Prostate health is one of the most important but often overlooked aspects of men's health, particularly as they reach the age of 55 and beyond. Prostate problems can start silently, with very few noticeable symptoms at first. This is why it is critical for men in this age group to pay close attention to any changes in their body, even those that seem mild or easily explainable. Ignoring potential signs can lead to serious health issues, including prostate cancer. In this video, we'll cover the silent symptoms of prostate problems that men over 55 should never ignore. 1. What is the prostate? Before diving into symptoms, it's important to understand what the prostate is and how it functions in the body. The prostate is a small gland about the size of a walnut located just below the bladder. It surrounds the urethra, the tube through which urine and semen pass. The prostate's primary role is to produce seminal fluid, which nourishes and transports sperm during ejaculation. As men age, the prostate can undergo a variety of changes. The most common issues that arise are benign prostatic hyperplasia, BPH, non-cancerous enlargement of the prostate, prostatitis, inflammation or infection of the prostate, prostate cancer, a malignant tumor in the prostate, which may develop slowly over years without noticeable symptoms. Understanding the role of the prostate is key to recognizing when something might be wrong. 2. Common prostate conditions. As men age, especially after 55, the prostate becomes prone to certain conditions that can impact daily life. Here are the 3 most common prostate conditions to watch for. Benign prostatic hyperplasia, BPH. BPH is the non-cancerous enlargement of the prostate. It occurs when the prostate grows larger, often pressing on the urethra, which can restrict the flow of urine. This condition is very common in men over 50 and can lead to problems with urination. Prostatitis. Prostatitis is the inflammation or infection of the prostate gland. It can cause pain, urinary issues, and in some cases, fever. Prostatitis can be caused by bacterial infections or other factors, and it can be either acute or chronic. Prostate cancer. Prostate cancer is one of the most common cancers in men, especially those over the age of 55. However, it often grows slowly and can remain asymptomatic for a long time. In fact, many men with prostate cancer have no noticeable symptoms until the disease has progressed significantly. 3. Silent symptoms men over 55 should watch for. As prostate issues tend to develop gradually, the symptoms are often subtle and easy to overlook. These silent symptoms can easily be dismissed as normal aging, but they could be indicators of a larger health issue. Let's explore the symptoms men over 55 should never ignore. 1. Frequent urination, especially at night. One of the earliest and most common signs of prostate enlargement is frequent urination. Men with BPH often find themselves running to the bathroom more frequently, especially at night. This condition, known as nocturia, can disrupt sleep and severely affect quality of life. If you find yourself waking up multiple times throughout the night to urinate, this could be an early sign of a prostate issue. Even though frequent urination can be a part of the aging process, it's important to recognize when it becomes excessive or interferes with your daily life. If the urge to urinate is constant, or if it's happening more than once or twice at night, it could be worth investigating. 2. Weak or interrupted urine flow. A weak urine flow, or a stream that starts and stops intermittently, is another red flag for prostate issues. This happens because an enlarged prostate can put pressure on the urethra, making it harder for urine to flow smoothly. Men with BPH often notice that they have to wait longer to start urinating, or that the stream is much weaker than it used to be. If you find yourself straining to urinate or feeling like you haven't completely emptied your bladder, these could be signs that your prostate is affecting urinary function. 3. Difficulty starting urination. Some men experience difficulty getting their urine flow started at all. This can be frustrating and may even make you feel like your bladder isn't emptying properly. Difficulty starting urination can occur when the enlarged prostate presses against the urethra, blocking the normal passage of urine. This can lead to a sensation of urgency or discomfort when trying to urinate. While this is a common sign of BPH, it can also occur with prostatitis or prostate cancer, so it's important to pay attention to the persistence of this symptom. 4. Pain in the lower abdomen, pelvic area, or lower back pain, or discomfort in the pelvic area. Lower abdomen or lower back is often a symptom of prostatitis. Chronic prostatitis can cause a dull, aching pain in these areas, and it may worsen with urination or sexual activity. If the pain is accompanied by other symptoms like fever or urinary discomfort, it could indicate an infection or inflammation of the prostate. In some cases, pain in these areas can also be a sign of prostate cancer. 5. Blood in urine or semen. Blood in the urine, hematuria, or semen is one of the more alarming symptoms of prostate problems. This could be a sign of prostatitis, BPH, or even prostate cancer. While blood in the urine or semen is not always linked to cancer, it should never be ignored. If you notice this symptom, it's important to seek medical attention immediately for further investigation. 6. Painful ejaculation. Pain during ejaculation can be another indication of prostatitis or other prostate issues. This can range from mild discomfort to severe pain and may be accompanied by other symptoms, such as pain while urinating or pelvic discomfort. Painful ejaculation can also occur in cases of prostate cancer, particularly if the tumor has spread to surrounding areas. 4. Why these symptoms often go unnoticed. Many prostate conditions, especially in the early stages, develop slowly and without obvious pain. Symptoms like frequent urination or a weak urine stream are often mistaken for normal aging. Some men may even assume that these issues are simply part of growing older and on to seek medical attention until the symptoms become severe. Additionally, prostate issues can affect men differently. Some may experience 1 or 2 symptoms, while others may experience none at all. This variability makes it even more important for men over 55 to be proactive about their health and recognize when symptoms start to interfere with their daily lives. 5. The importance of regular screenings. For men over 55, prostate screenings are essential. These tests can help detect issues like BPH, prostatitis, or prostate cancer before they become more serious. 2 of the most common screening methods are digital rectal exam, DRE. The doctor manually examines the prostate through the rectum to check for abnormalities. Prostate-specific antigen, PSA test, a blood test that measures the level of PSA, a protein produced by the prostate. Elevated PSA levels can indicate the presence of prostate problems, including cancer. Although not every man needs to be screened every year, it is essential to discuss your prostate health with your doctor and follow their recommendations based on your symptoms, family history, and overall health. 6. Prostate cancer. Early detection saves lives. Prostate cancer is one of the most common cancers in men, especially as they age. The challenge with prostate cancer is that it often grows slowly and doesn't cause noticeable symptoms until later stages. This is why regular screenings and early detection are crucial for improving the chances of successful treatment. While prostate cancer is often asymptomatic in its early stages, some men may experience symptoms like pain during urination, blood in the urine or semen, or difficulty starting urination. If prostate cancer is detected early, there are many treatment options available, including surgery, radiation therapy, and hormone therapy. 7. Lifestyle changes to support prostate health. Although some prostate issues are genetic or inevitable, certain lifestyle changes can help reduce the risk of developing prostate problems. Here are some tips to improve overall prostate health. Eat a balanced diet. Focus on a diet rich in fruits, vegetables, whole grains, and lean proteins. Certain foods like tomatoes, broccoli, and green tea may have protective effects on the prostate. Exercise regularly. Physical activity can help maintain a healthy weight and reduce the risk of prostate problems. Limit alcohol and caffeine. Excessive consumption of alcohol and caffeine can irritate the bladder and exacerbate symptoms of prostate issues. Quit smoking. Smoking is linked to a higher risk of prostate cancer and can exacerbate other prostate conditions. 8. When to see a doctor if you notice any of the symptoms discussed above. Don't wait. It is better to get checked out early than to ignore signs that could indicate a serious problem. Early intervention can prevent complications, improve quality of life, and in some cases, save your life. Prostate health is a major concern for men as they age, and ignoring the silent symptoms of prostate issues can lead to serious health complications. If you're over 55 and notice any of the symptoms we've discussed, don't hesitate to see a doctor. Regular screenings, a healthy lifestyle, and being proactive about your health are the best ways to ensure